5 children with severe hearing loss from the northern region have undergone cochlear implant surgery at the Kolebu Teaching Hospital. The corrective procedure, which allows children who are unable to hear to regain hearing through technology, were fully sponsored by Qatar Charity.
Hearing loss affects millions of people around the world, and the World Health Organization reports that about 5% of Ghana's population live with some form of hearing impairment. For children, the impact is especially severe when the condition occurs before they learn to speak. Without early intervention, these children often struggle with language development, learning, social interaction, and overall growth. At the Kolebu Teaching Hospital, specialists say many cases of childhood hearing loss arise from complications at birth, severe infections, neonatal jaundice, and other high-risk medical conditions. Currently, Ghana does not have a nationwide system for early detection, hence, many children are diagnosed late, at age 3 or 4, at which point much of the critical speech development window has already passed. For children whose hearing loss is profound, hearing aids are not enough. Cochlear implantation becomes the only option to help them to regain their hearing. The surgery involves placing an internal device under the skin and inserting tiny electrodes into the inner ear. After healing, an external device is added to receive sound and transmit it to the brain. Since cochlear implants were first introduced at the Kolebu Teaching Hospital in 2021, about 22 children covering 45 years have benefited, but many more are unable to access the procedure because of its high cost. Families currently pay up to $22,000 per year, an amount that places the surgery far beyond the reach of most households. Qatar Charity performed cochlear implant procedures for 5 children from the northern region free of any charges. The sponsorship covers both surgery and post-operative care. Qatar's lead ear, nose and throat surgeon Dr. Abdul Karim Al-Balasi described the cochlear implantation as one of the most life-changing procedures in modern medicine, restoring hearing, language and human connection.
Cochlear implantation in the early years of age, it's very beneficial to get the language. Bilingual early is more better result, cochlear implantation, better than elderly patient, because elasticity of the brain is liable to get the language early.
Chief audiologist at the Kolebu Teaching Hospital, Ms. Jemima Finn, explained that surgery is only the first step. Need months of rehabilitation, mapping sessions, and speech training from audiologists and speech therapists to learn how to interpret sound and speak confidently with peers.
Interventions for hearing loss, most of the time we start with hearing aids based on the level of hearing loss. But there are some children, if the hearing loss is severe to profound, they will not benefit from hearing aids. And so cochlear implantation is the mode that we employ to be able to give the child a hearing. You restore the hearing to the patient through cochlear implantation.
For the families involved, the sponsorship offers more than medical care. It offers hope that their children will say their first words, hope that they can grow, learn and thrive, and hope that hearing loss will no longer keep them isolated from the world around them. Zero for GBC News, Kolebu Teaching Hospital, Accra.